Works out. Hello, everyone. Welcome to the 12th episode of the AI Healthcare Podcast. I'm your host, Dylan Reed, and today we are joined with my friend, Sarah Hughes, who's the founder of NurseFusion. Thank you for being here, Sarah.
Thanks for having me, Dylan. Absolutely delighted to be talking to you about this.
And when did you realize that the nursing field needed to embrace AI?
Oh, well, for me, it was literally the second ChatGPT landed. And I say that because traditionally in healthcare and nursing, we're not really exposed to these types of technologies. And so as soon as OpenAI launched and ChatGPT came out, my gradual realization was really shaped from a blend of clinical experience and my role in digital health leadership. So for me, it was more seeing that the experiences that I'd had previously and my passion and curiosity for technology in this space sort of really enabled me to see a bird's eye view of I've been doing nursing health tech stuff for 22 years now. I can see where it would work here, here, here. We could apply it here. We could do predictive analytics here. We could help with workforce here. We could, change the paradigm of clinical care for patients. So I definitely massive thanks to OpenAI because it's just going to change the way we deliver healthcare.
And could you explain kind of the current nursing environment in Australia?
Sure. So we have a really dynamic yet challenging environment over here at the moment. Since COVID came, our workforce has reduced to a degree. We have highly skilled nursing workforce, but often they're under immense pressure due to these staff shortages that we have. We have high patient loads. We have increasing complexity of healthcare needs. We have an aging population. COVID really shone a spotlight on these challenges that we have. So, as of 2023, the last data that we had showed that we've got nearly 500,000 nurses at the moment here in Australia, which seems a big number. But, nursing is 3-shift roster. Plus, we have varying degrees of registered nurses, enrolled nurses, midwives. We have nurses that are leaving the workforce because of COVID and because of these workforce pressures. I imagine it would be much similar to where you are over there. So interestingly, the nurses that are grouped in the ages of 20 to 35 have actually increased in numbers by 24%, which is fantastic because, we need more nurses. We're obviously bridging that gap in education. Irrespective of COVID, we're still seeing an interest in people stepping forward into nursing, which is fantastic. And now you layer on technology over the top of that, and it's a whole nother level of interest to people wanting to step into healthcare. So it's actually a really exciting time in Australia for nurses and clinicians.
And is the nursing environment in Australia, does it depend on kind of the city in the sense that you'll see more nurses per capita in like Melbourne or Sydney or even Canberra than in comparison? Okay.
Absolutely. One of the big challenges we have are getting skilled nurse practitioners, remote and Indigenous nurses out into the community because it is so vast out of here. So, for example, if you wanted to work in remote Northern Queensland or remote Northern Western Australia up the top, it's dry, it's hot, it's arid. They have really good health facilities at the central main towns, for example, Pilbara, and up those areas. But you have outposts. So the nurses have to go out with the doctors, and you've got Royal Flying Doctors. So it's this whole different landscape of rural and remote nursing. It's very different. And yes, you're quite right. It is a lot smaller in size with staff.
And so is it kind of a struggle to try and tell these, because you were saying that the 20 to 35 age demographic of nurses has increased, you said by 24%. Is it kind of a challenge to try and convince these people that saying, hey, rural Australia also needs help too?
I think it's dependent on their exposure.
Mm-hmm.
So it's a big ask to say to someone who's born and bred in the city, would you consider going to the country and taking your family? But by the way, we have 80% less of what you're used to having at your fingertips. But it's phenomenally rewarding. It's such a wonderful experience for you and the family to go out there into the community. It's very different mindset from the clinicians that are highly skilled, highly trained, used to that acute hospital environment. And then community is very different. It's very broad, it's very diverse. You don't really know what's coming in the door at the emergency department, or you could be 500 k's from a hospital and something might happen.
Mm-hmm.
So it's a different skill set.
And how can, based off of the, common issues that you see in nursing in Australia, how do you see NurseFusion solving them?
Oh, that's a good question. So NurseFusion is really still in its infancy.
Mm-hmm.
So I'm looking forward to evolving with it, to seeing what we can do in that space. So really for me, I think creating an awareness
Mm-hmm.
through thought leadership content, or highlighting current trends in digital technology, things that will give back to the workforce or help a hospital organisation manage their workforce, demonstrating what nursing education opportunities we have out there at the moment. For example, over here at the moment, we have free enrolled nursing training for certain states.
Mm-hmm.
It's all covered by government if someone wants to go off and do a diploma of nursing for 80 months, which is phenomenal. I like to try and highlight what are the current trends, and futuristically, where can we see them in health?
Mm-hmm.
So I think emphasizing the importance of supportive work environments for nurses is good. Career development opportunities is good also. Big advocate. I'm a super adopter for anything that's a health technology that will help, that's user focused.
Mm-hmm.
So I tried to really leverage the experience that I've got
Mm-hmm.
and develop content or thought articles that really encourages other people to maybe see something different or a different application that can be brought into the clinical space, or
Mm-hmm.
maybe help them think about how they innovate
Mm-hmm.
and what does that look like and what does that mean.
Mm-hmm.
Because it's, as I said, it's exciting time for healthcare over the next 10 years. I think there's going to be phenomenal changes.
Mm-hmm. No, of course, I definitely agree. And, as a side note, I did read your article on AI application in Australian healthcare, and it was a great overview for someone like myself who's not an Australian. It's kind of comparing and contrasting the differences that we see here in the United States with our healthcare system. So I wanted to congratulate you on that. That was a very well
Oh,
written
thank
article.
you. Excellent. Thank you. That's really good feedback.
And where do you see nursing going in the future in Australia, and how would you like to see NurseFusion become a part of its process?
Oh, we are going to be so tech enabled.
Mm-hmm.
So, for context, 22 years ago, paper based, everything was paper based. So, to raise a really valid point, and a point that is often talked about, you can still nurse without technology. So I think I need to make that point very clear. We can still care for a patient without technology. So it's learning how we use technology to help us, to enable us to do things better for the patient, or better for the clinicians, or better for the hospital.
Mm-hmm.
It's learning to use it as like a toolkit, so to speak.
Mm-hmm.
And that's really important, because in nursing, it's really a cultural shift. We
Mm-hmm.
haven't worked with tools like this before, to the degree that there is exposure, for example, artificial intelligence, as we're getting exposure with that in healthcare now. I meant to say too about Microsoft has signed a deal with one of the biggest hospitals we have in New South Wales to bring in AI so that cardiologists can use it when they're looking at radiographic scans, which is literally just landed last week. So really, it's about making sure that there is a focus where the patient is at the center of anything that's tech. They have to be, because why the development of technology must offer something substantial
Mm-hmm.
for users to adopt it and to continue to use it
Mm-hmm.
and train others on it.
Mm-hmm.
I think it would be really fantastic for more elective subjects to be built into undergraduate nursing programs over here. So, for example, innovative thinking, digital trends, digital tools, or digital health that's more than just telehealth. We're starting to slowly build some of this into the nursing curriculum here.
Mm-hmm.
And I think they're doing a phenomenal job doing that, which is good, because, you know, if someone steps out of high school in 5 years and does an undergraduate nursing course, it'd be very different to how we did it 22
Mm-hmm.
years ago, which is, you know, that's change. I think that's
Mm-hmm.
really good. I think for third year nursing students, having an option to pick a few extra courses before they go out into the real world is really important to set them up for success, because these are the digital leaders, essentially. Any hospital that they step into that has a new digital tool,
Mm-hmm.
they're our future nursing workforce. So wouldn't you want to set them up for success? That's how I see it.
Mm-hmm. And
You go.
what are the kind of the regulatory um bodies, and like how are they kind of reacting to that?
It's a really good question. I think they're adapting as fast as they need to.
Mm-hmm.
They're spending the right amount of time doing the right amount of research to try and make sure the content that is being embedded is relevant to what's happening and what's legislated over here in Australia, which is really important. I like to sort of think of it like the foundational few years. I really would love to see AI or coding something, you know. I'm a super adopter, so one could think that, hey, maybe there's an elective if you want to do another year on top of an undergrad nursing degree. Maybe there's a fourth year sitting there with all these wonderful subjects, but that's a long way away. That's just because I love technology and I can see where it can go for nurses in the future.
Mm-hmm. No, no. I personally love kind of seeing how AI can be applicable to healthcare, because there's just so many avenues that you can take it.
I agree. There
Mm.
really is. And, you
And
know, I don't think we know all of them yet.
no, I don't think we do. I think
No,
we're just scratching the surface right now.
same. I totally agree.
And specifically, in Australia, what do policymakers need to understand about nursing and its applicability to AI?
Uh, okay, so policymakers really need to recognize integrating AI into nursing or medicine.
Mm-hmm.
It's not just about technology advancement. It's more about enhancing the quality of care and well-being of the patients, the staff, the nurses. I think it's really crucial to invest in right infrastructure
Mm-hmm.
and training to ensure that, you know, this digital shift and the new future state that we're looking forward is well supported.
Mm-hmm.
Um, and it really needs to have a very strong focus on ethical considerations and really trying to maintain that human connection in healthcare, because AI should be seen as a tool to augment nursing practice, not replace it.
Mm-hmm. And where can people find more about you, Sarah?
They can reach me on LinkedIn.
Mm-hmm.
They could, or nursefusion.com.au. They can jump online and have a look and send me an email, subscribe to the website if
Mm-hmm.
they'd like to get in contact. Always happy to talk.
Awesome, great. Well, thank you again, and do not forget to hit the like button and subscribe to my channel. Podcast episodes are also available on Spotify and Apple Podcast, and do not forget to check out my newsletter, the AI Healthcare Report, on LinkedIn. This is Dylan Reed signing off. Thank you so much for your time, Sarah.
No worries. Thanks, Dylan.
And recording.